Here from Adam Searing with the North Carolina Health Access Coalition. He is a healthcare guru in the Raleigh area and a prolific blogger about this issue and Blue Cross in particular. And he's here in support today of Searing, and we just welcome him. Thank you, Adam.
Woo! Thank you for having me come here. I'm so excited. I've been a healthcare advocate for 12 years, and I've always wanted to protest in front of Blue Cross Blue Shield, and Searing is making that possible. So thank you. Listen, you see those glass walls up there? Right at the top floor, there are some really fancy offices. And there are some fancy executives sitting in those offices who are getting paid millions of dollars. And do you know what those fancy executives are plotting? They're sitting up there, I'm sure they're sitting up there right now, and they're plotting how to destroy our healthcare reform. Are we going to let them do it? No! We're not going to let them do it. No way! No way! You know what? In the 1930s, Blue Cross Blue Shield was formed. There was a grant from the Duke Endowment. There were people who donated their hard-earned money saying, we need affordable health care. A nonprofit is the way to go. What did they do with that legacy, I ask you? What did they do with it? Where are they right now? Are they for affordable health care, or are they against it? They're against it. Then, over the years, tax breaks. Governors said buy Blue Cross. Tax breaks for Blue Cross. They got bigger and bigger and bigger. And in the 1990s, the idea of affordable care began to change. Because why? Because suddenly you could make money off of selling people health insurance. You could get rich. And who's getting rich up there? Is it us or is it them? Yeah. They're getting so wealthy, the CEO makes $4 million a year. Does anyone know what his bonus was last year? $766,000. Did anyone get a $766,000 bonus last year? No! Shoot! That's right. We didn't get anything. We got a 20% increase in our health premiums to pay for that bonus. Is that right? No! No way. So now they got Blue Cross gets 96% of the individual market. You go out and buy health insurance by yourself, you got one choice. What's that choice? Is that fair? No. What do we want? We want a public option. If you're trying to buy health insurance for a company, 3 out of 4 people, what's their choice? Blue Cross Blue Shield. Is that fair? No. What do we want? We want it all. We want it all. You know, I'm going to close right now. And you know what? I was talking about those fancy executives up there. Bob Gretchen, the head of Blue Cross Blue Shield, he was talking to a bunch of business executives a few weeks ago. And do you know what he said?
No.
No.
Tell us.
I didn't know what he said either, but I couldn't believe it when I heard it. He said, here's what he said. He was asked about health reform. He laughed. He laughed and he said, we're having a lot of fun with that. Well, maybe fun for him, but not fun for people who are trying to afford his health premiums. And you know what else he said? It's not going to happen for 5 or 10 years. Well, let's prove them wrong. Let's get a public option. Let's tell them and everybody else that we need real health care reform in this country. Are you with me? Are you with Searing? Yeah.